All right, we are My Side Effects. We're basically personalizing side effect information for each patient because each patient is special, but you can't see that. All right, so basically what I just said, please remember, and then I move on. So the story is basically the same for each patient, and you probably noticed that yourself. When was the last time that you took, for example, ibuprofen? Did you check the side effects for ibuprofen? Did you check the label, what was listed there? Did you maybe compare it against paracetamol to check which one had better side effects for you? Probably not, because the information is not really presented in a way that can be easily legible for a patient. This problem is actually the same for physicians and for healthcare professionals in general. Basically, we know that medicine is acting differently on different people depending on their physiology or genetics, but we're not really looking into how adverse events are being impacted. How they are impacted depending on the individual. Yeah. One thing I guess worth mentioning, this problem of adverse event costs around 15% of the annual hospital budget, which is only in the US alone per year is 150 billion. So that's a lot of waste of just managing side effects that people get from taking drugs. So our solution is actually surprisingly simple. It's basically about personalizing, taking your profile and then serving up basically, depending on treatment, how the side effects will be affected to your characteristics. So you basically put in your age, weight, and gender, and a couple other characteristics. You choose your product, and then out comes basically a personalized report on how this treatment is for you and with your characteristics. So for the patient, I mean, this is kind of, you probably all relate, it's quite straightforward how the benefits can be here. I mean, you will have a more informed decision, you can have a better discussion with your physician. More empowerment also means more engagement in actually following through with treatments. Being able to go through and basically decide on which product or which medicine fits best with what risk you want to take in your with adverse effects or side effects. So basically the benefits don't really stop there, because if you look into the overall healthcare system, being able to personalize adverse effects to individuals have a huge potential. I mean, both for physicians to provide better treatment decisions, but also for reimbursement purposes to be able to reimburse more accurately what a drug actually costs. Not only the pill, but for the whole system, how much it costs to actually deliver this treatment. And then of course for the hospitals to be able to somehow manage this enormous cost. So going into a preview of the solution.
Yeah, I will present to you a preview of our solution. So first you have this entry point of our web app, which allows you to enter the data about yourself that we can then generate for our system in order to give you better predictions that are personalized than a label that has general data could give you. So you enter your stuff there, and then you get this nice search mask, which is essentially like Google search, except for like a certain drug. So you could, I don't know, put a painkiller name, aspirin or something like that. And then you can get results that show you, for people like you, how did the empirical results, and those empirical results come from a very large database called OpenFDA. It's available online openly. It has records that are updated quarter-yearly, and they have like millions of records about countries, different countries on different continents, and so on. And we have a huge database behind this, and then we get like adverse effect counts for different adverse effects. We also have visualizations of these, so you can have like a plot and you can kind of see what is like the worst kind of condition. It's a bit fuzzy on the screen, I'm sorry, but you can zoom in on the plot if you have the web app. And yeah, that's what I will tell you. Now we talk about our team journey a little bit.
1 minute.
Hello everybody. Well, the group is big, so we decided to split. First, get to know each other. We have different backgrounds. I am a biologist, and these guys are specialized in machine learning. So we try to combine our experiences and design a solution. Then we split the team because we're a big team in a back end and front end. And then always interact to improve our design solution. That's it, and that was the result of this collaborative work. Thank you.
So overall, we had a lot of fun, and I guess we have a couple of next steps, but I want to really get to the next slide, which is the thank you to all the libraries that we use to actually make this happen. We pulled data. It was like 1.2 million entries, so data points, so quite a lot of data to crunch through. But in the end, it was a lot of fun, and there was always a bit of hiccups throughout, but we made it in the end. Thanks.